here in Cincinnati, with very little being done to change that situation so that if you happen to be in a community that was low income and poor, if you happen to be Black or Hispanic or Appalachian, you were going to have a less of a life experience, life expectancy, higher mortality. And so we were working for the last 9 years to try and change that situation so that it didn't depend on neighborhood, it didn't depend on income, it didn't depend on race. It depended on how soon you could get to your diagnosis. We found 9 years ago a program in New York run by a cancer physician named Harold Freeman, who is the grandson of slaves, who was a graduate of Howard Medical School. And he came to Harlem Hospital in New York, and he was a cancer specialist, a cancer surgeon. And most of his patients died. And he was absolutely floored by this because they had come too late in the diagnosis. They had come in stage 4, and he couldn't do very much for them in stage 4. So he developed a community program where people called navigators went out into the community and tried to get people to come earlier. And he was very successful, so successful that he became the second African-American president of the American Cancer Society. And his ideas about navigation spread across the country, except they didn't get to Cincinnati. And so I invited Dr. Freeman to come to Cincinnati and talk to us about why we should have it. He did come. He talked to all the hospitals at a wonderful meeting we had 10 years ago, and none of them wanted to move ahead on it. So the situation prior to Trump was already a situation of great disparity, great difficulty, and we've been working with a team of navigators to try and change that. But we are really a drop in the bucket, a small drip in the ocean of inequality in the city in terms of healthcare. So, but that was healthcare as we knew it. We knew that most people would go to an emergency room. They get treated there if they were poor. They didn't have a doc. But most people with cancer would die of it who were poor. And when COVID came, all of our activities shut down. All of our attempts to bring people, including from the church here, to screenings all stopped. We were able to get the vaccination when it was finally invented and approved, and we provided vaccinations, and we did it here at the church several times, which was wonderful. And we did hundreds of vaccinations in the city of Cincinnati for the population that, largely African-American population that didn't have access to it. And we saved hundreds of lives. There's no question about that. But it was daunting to us that we realized that we would never be able to change this discrepancy between rich and poor in terms of healthcare in the way that we were doing it, by going to churches and talking to churches about getting involved in getting their people screened, and then getting them to treatment, helping them with the treatment as well. So we began to rethink what we could do differently. And so what we did was we set up a coalition of health justice, we called it, a group of about 22 organizations in the city that said, we'll agree to come together and talk about what we can do as an organization to change the discrepancies in healthcare. And so we began to meet and began to talk about what could we do? How could we change the hospital's attitudes towards the poor? How could we change Children's Hospital attitude towards Avondale and towards the children and mothers of Avondale? How could we change any hospital that's working so that they could actually be a benefit to the community in an explicit way, that the community would know about it? And in that process, the UC Cancer Center invited me to be on their first community advisory board. So we felt that was a breakthrough. So I'm the co-chair of that right now. And we are trying to think about how do we get the community involved in cancer prevention. And so we are being visited as a community board by surgeons and physicians from the UC Cancer Center who are basically saying the following: we can't get patients to stay in our process. We figure out that with a pap smear, that they have cervical cancer, but they won't come for treatments. Or we learn through a lung cancer screening that they have lung cancer, but they won't come to screening. Or people are not coming for their colonoscopies. What do we do? And we met last week with a woman who was in charge of colorectal cancer for UC and Children's, and she was this close to panicking, not over anything that had to do with Trump, but had to do with the whole issue of what are we doing wrong as physicians that are keeping people out of treatment and therefore raising their mortality rates? So we began to talk to her about what we do here at Christ Church Cathedral. Have you chosen the possibility of eating with people and talking with them as human beings about why colonoscopies are important? No, we haven't ever done that. Have you ever gone to a community center and sat with people and talked with them about why colonoscopies are important? No. Okay, so we're going to begin to do this sort of kindergarten stuff with people. So in the midst of this all, we have these radical changes that have happened in the last 150 days in the area of healthcare. So on one hand, we have the status quo, which is very poor healthcare for large numbers of people in our society, in our city. And then we have this massive attack on the funding formula for people getting healthcare, which is Medicaid. So yesterday we had a professor from Xavier, Ernest Davis, who talked in detail about if you cut the funds for Medicaid, this will affect hospital budgets. And if it affects hospital budgets, it'll affect, because not only are you cutting funds for Medicaid, you're cutting the overhead that hospitals charge to get laboratories set up, employees for laboratories set up. And if you cut the funds for Medicaid and there's not money for the laboratories, then there's not money for the new prescription drugs or new treatments that could come out. And if there's not money for the new treatments that come out, that means higher mortality. And that means less access to the best state of medicine that could exist. And that means more emergency rooms being filled. And that means the shrinkage of the medical schools as more and more people realize that they are not going to be able to go to the same kind of medical school that they went to before. They're going to have to not concentrate, if they want to, on public health issues, on being physicians that work in either Indian reservations or inner city communities or whatever. They're not going to be interested in being supervised in the way in which Trump wants to supervise, or Robert Kennedy Jr. is now proposing to do this. So there is a domino effect. If you cut funds for Medicaid, you're hitting families with children with disabilities. You're hitting non-English speakers. You're hitting the poor. You're hitting people in every state. In our state alone, there are over 500,000 people on Medicaid. So if they're cut over 10 years, it's going to be a substantial impact on the hospitals, the doctors, the patients, the communities that exist. So we're going to see an upswing in mortality rather than a leveling off or a return to a better state of existence on the part of what's really happening. So we heard yesterday from this hospital expert, we heard from a physician who is basically saying that it's not only going to affect Medicaid, it's going to affect Medicare. And there's a $90 billion profit that insurance companies are making right now off of Medicare Advantage. So he would like for us to think about taking that $90 billion from the Medicare Advantage program and putting it into Medicaid and saving Medicaid. He was very, very eloquent about the consequences. He's a former member of the Cincinnati Health Board, and he basically said that Cincinnati Health Department will suffer severely if they take Medicaid funding away in any shape or form. That 1 out of every 5 Cincinnati citizens are on Medicaid and use the Cincinnati Health Centers. So it's going to change the way people interact with the health centers themselves. Another excellent speaker we had yesterday was Eve Bolton from the Cincinnati School Board. She's the vice president. And she said that if you cut Medicaid, it's going to cut the school-based clinics that exist. We have more school-based clinics in Cincinnati than the entire state of Ohio has in all of its school systems. They actually serve not only the children who are poor, but they serve the families of the children who are poor. So all funded by Medicaid. So if that is cut, then it's going to have a dramatic impact on the schools. If you cut at the same time the food programs, so that Kennedy, in his latest report called Making America Healthy Again, talks about the bad nutrition in the schools. And so instead of proposing what we could do differently to make better nutrition in the schools, he just says abolish it. So there are children who depend on 2 meals a day from the Cincinnati schools. If you abolish that food, bad as it may be, you are going to raise their truancy level and their mortality rates. We had Florence Rothenberg, who's a cardiologist at the Veterans Administration yesterday, talking about the latest research that's been done on cardiology in the Veterans Administration says that people live longer with good cardiology treatment. Veterans live longer with good cardiology treatment. But at the same time, yesterday, Kennedy announced that no longer should we accept the possibility that researchers will use the New England Journal of Medicine or Lancet magazines for publishing of latest information on healthcare or on research. They're absolutely terrible magazines, he says. They're the creatures of the pharmaceutical industry. And he has tremendous dislike for the pharmaceutical industry and basically says we should not trust anything from the pharmaceutical industry, let alone their publications, and we certainly shouldn't trust their drugs. And we certainly shouldn't have vaccinations for everybody, particularly healthy people, whatever that means. People above the age of 6 and under 65 should not have vaccinations. And so we see terrible things beginning to happen. The rise in measles, the incidence of polio increasing. We see the rise of anti-science attitudes on the part of larger and larger populations. And we see the government encouraging that kind of behavior. So the topic of my talk, the title of it, we are not going to see healthcare as we have known it. We're going to see a brand new kind of healthcare, a healthcare that goes back before LBJ, Lyndon Baines Johnson's work on the war on poverty. We're going to see a return to segregated hospitals. We're going to see a return to higher mortality rates in our inner cities, and particularly in our city, because our health departments are going to have to either consolidate or close down. So we're facing massive changes that's going on, and we haven't had massive protests of it. We've had some protests about it, which is great. I was at a protest at the Veterans Administration Hospital by the nurses. It was very, very well attended, and Representative Landsman was present at that, and he's taking a very important role in this. But basically, for the next, E. Bolton says, for the next 2 years, we are in for just as much as possible the destruction of the American health system, and of course, the American system of government as well, the rule of law. I'm still recovering from the fact that Trump gave pardons to the January 6th people. And then yesterday, of course, he outdid himself by giving it to criminals and other people. But more importantly, how should we respond? What should be our response? And so your distinguished chair of the 5,000 Club yesterday, Prince Brown, gave a very stirring speech about we need a strategy, a real strategy for thinking about how to change what's really in front of us. Not to let people be ignorant about vaccinations or science or the impact of Medicare cuts, but to really understand what's going on and to really change from being, well, you know, this is life as usual to we must do something about it. What we have to do about it, we don't know. So we're writing letters. We had petitions yesterday that we're sending to our Congress people. And we're stymied beyond that. We don't really have a lot of answers beyond that. So I'll stop at that point. And if you have comments or questions, I can certainly do that. And I'd be interested in what you had to say. Yeah.
So Nadia makes a trademark the railroad crossing sign up. You have to have a tragedy before they do something. I wonder if that is what's happening now. The economy's pretty good. I mean, there are challenges, of course. And I'm thinking about why are people not,
right,
to me, not protesting? Well, because I think things are going pretty well. They haven't seen the effects of these cutbacks yet. So what do you think needs, unfortunately, what needs to transpire before we get to the point where there's going to be a greater public response?
Steve, you might have to repeat the questions. I think we'll be able to hear people if they have questions there, but I don't think they can hear our audience.
Okay, so basically, if I heard your question correctly, what can we do to change people's minds to take action about what's really happening right now? And I don't have a good answer for that. I was talking to a rabbi this morning, and he was saying it's amazing that there was no response on the part of the religious community to the killing of the two representatives of the Jewish embassy in Washington last week. That the killing of these two young people was not even a blip in terms of religious organizations coming together saying this is outrageous. This is the kind of anti-Semitism we've got to stop. So that didn't do it. Eve Bolton said that her feeling is until some major corruption comes clear in terms of what Trump is doing, people will not wake up. It'll have to be a train wreck, as you're saying so well. The question was, would it take a train wreck to get a crossing light, so forth? What kind of disaster would really make a difference for people? It's not clear. In the state of Kentucky, as we know, FEMA is not there yet. And the tornadoes were, what, 2 or 3 weeks ago? And you sort of wonder, what? And because there's a Democratic governor, we're not going to get FEMA to help those people in Kentucky. It's outrageous. It's another shocking, immobilizing outrage that we don't know what to do. So I think we've got to think more about what to do. But I think this kind of meeting is just exactly what we need to do. We need to have more of these meetings.
You have some comments in the chat.
Okay.
What are your thoughts about how we can get the word out on the impact of these cuts? I think you already answered that. I believe educators who are involved in completing documents for students' eligibility for Medicaid understand the implications.
Well, I was in a meeting of this community advisory board and at the UC Cancer Center, and we heard from a young researcher who was researching leukemia in children. And she has clinical trials. So her clinical trials have gotten children from 0 with leukemia to 10, and then they die. They are working on clinical trials to get people from 10 to 20, into adolescence, into young adulthood. They have to stop the clinical trials because the funding is not there anymore, or they're feeling like they're going to have to stop that. And here they are telling families, which I can't imagine what this is like, to actually be a doctor and say to a family, we can't really continue the experimentation with this drug to make it safe so that your child would have another year or 2 or 3 or 5. We met with another doc. These are terrible stories of working with children with a kind of leukemia where there's no red blood cell production. So if there's no red blood cell production, the child must be transfused in order to live. That clinical trial to try and figure out how to start the red blood cell factors in the marrow is not going to be allowed. It's not going to be continued. How do you tell the parents of those children that they're going to be on transfusions for the rest of their lives, which of course means they're going to have a shortened life because the transfused blood has lead in it or materials in it that will weigh the heart down, eventually stop the heart. It's grisly. It's absolutely grisly. So I'm sure those families would be awake to what can we do differently? We can't certainly protest to the hospital. I think if I had my druthers and if the dean were here, I would say, let's do this conversation on a Sunday morning in your church. And let's see if we can get people in the church to say, what do you want us to do? What can we do? What would be useful? Is prayer useful? Yes. Is coming together and talking useful? Yes. Is voting important? Coming in the coming midterm elections? Absolutely critical. But what can we do in the interim? we need to be together. We need not to be isolated and defeated by this wave of insane behavior. Can you imagine a murderer being pardoned yesterday for reasons that are not clear? Can you imagine people who are in jail for fraud and murder being, can you imagine the January 6th protesters being? We're going to give $5 million to the family of the young woman who was killed by the police officer protecting the Senate and the House of Representatives. We're in a different world. This is a different world. And so we have to be different.
So another question is, you mentioned you went to the 7 hospital
Right.
events 10 years ago, and they said they did not want to work. So I'm sort of interested in, so what do you think happened? Why did they not have, they took the process at other cities, but not Cincinnati?
Wow, that's a great question. Why didn't the hospitals 9 years ago, 10 years ago, jump at the possibility of having navigators, which would improve their bottom lines in terms of money, because navigators keep people in the treatment process longer, which you can charge for. And it increases the health of people. They get the best treatment they possibly can by coming for their treatments. And the answer is varied answers. Various hospitals said, we're doing this already. We don't need navigators. We take care of our people completely. It's too expensive, however expensive it is. Every excuse they could possibly have. But most of them asked for the autograph of Dr. Freeman, which is kind of hilarious. I mean, it was just, it's part of that upside down world that we're in. That's right.
So I wonder what the difference.
Well, we went to the James, right? The James Cancer Center in Columbus. Some of you may know about the James. It is the one of 2 nationally cancer accredited hospitals in the state of Ohio. Cleveland Clinic is the other one. And we said to them, how'd you get your navigators? They have 22 navigators in their hospital on their budget. And they said, the president of our cancer hospital went to a seminar on the use of navigators in improving cancer care. He came back a zealot. He said, we've got to have this, and we've got to have it not as a temporary program, but as a permanent program. So we met with the people who are the navigators, and it makes you cry. I mean, Columbus is not that far away from us. I mean, that's nirvana. I mean, if you get cancer and you want a navigator, they have a navigator for every conceivable kind of cancer. So, and that navigator will help you with your transportation, will help you with your food, will help you with your employment. So I came back and I said to the community advisory board, what do we do with people who don't have money for food, who have cancer? And they said, we don't know.
Well, that's one hospital. 6 here.
Right.
So was that part of the issue?
I'm sorry.
That was on one hospital.
Right.
The James.
Right.
We have 6 here that are given proposal.
Right. But we have, each of the hospitals does not yet indicate they want to be accredited. We think UC is interested in being accredited right now. It brings a ton of more money from the federal government. And one of the reasons they involve me now is that they want navigators inside of UC. But the other hospitals have not been there. But the food point is, we wanted to find out which of the hospitals in the city have any kind of food program. And St. Elizabeth's has a pantry. Now, in the pantry, if you can imagine this bookcase over here, that's their pantry. And on the bookcase are boxes of food. And if you look at this bookcase and see it, every shelf on the bookcase is filled except for the bottom 2. It's just the opposite at St. Elizabeth's. Every shelf on their bookcase is empty except for the bottom 2. So I said to them, how come? You just built a 6-story cancer center here in St. Elizabeth's. Couldn't you afford to put some money into the food? And they said, no, it's all volunteer. It's all charity. And I said, well, what do you do when people come? And they said, you can only take a box once a visit you come to the hospital. I said, well, what about on the other days when they're hungry? We can't help them. And that's pre-Trump. So Trump is only on top of a system that is already not productive for an American society where people are really needy. But I think I don't want to use the word greed. I don't want to use the word selfish on the part of hospitals and doctors. But there is a provision, and this is what I would love to talk to the entire church about. Every hospital that takes federal money gets a tax write-off. They don't have to pay taxes, but they have to do something in the community. They have to do a community benefit. And the IRS has determined what a community benefit is. And believe it or not, what we do is a community benefit. We do health fairs. We do educational programs in the community about every form of cancer. We do educational programs on vaccinations, on diabetes, on heart disease. So UC spends in their community benefit area less than 0.1% on health fairs in their community benefit area. And every hospital has mirrored that particular formula. So 99.9% of their money goes to more salaries for doctors, more training for med students, nothing to do with the community directly, explicitly. So my feeling is that if we had a movement to change that community benefit from 0.1% to 2%, we could do a lot in these communities. And I think the way we're going to do that, hopefully, is have the Coalition for Health Justice argue with hospitals about changing their community benefit formula so that, and we don't even know how they set up their formula. We don't even know who's on the committee to determine how to spend. UC spends, I think, $900,000. I'm sorry, $900 million on their community benefit. How do they decide who's on that committee and how to make that money? We don't know. But every hospital has to make a community benefit statement, and they have to figure out how to use that money. But they only use, and this is nationally a problem, the IRS is fully aware that hospitals are playing games. That when you spend 0.1% on a community benefit and you get a tax-free status that's worth millions of dollars, then something is not fair in that system. So that could really make a difference. That could really change it. But that's a hypothetical. That's pie in the sky.
Yeah.
I have to get my glasses on. This is in Braille.
There.
I understand that many healthcare providers, hospitals, and physicians are held by large corporations and their focus is on profits. Have you been successful with these large conglomerates? Very short answer, no. We have not been successful with any hospital except for the UC Cancer Centers Community Advisory Board, and there we're still trying to educate about the importance of navigators. We're still making that particular point, and we're still. So you have this hospital that says we're committed to becoming accredited, and if we become accredited, we can compete with the James and be the third accredited hospital here in Cincinnati. So they've been working for the last few years to become accredited, and in the last 2 months, the two co-directors of the UC Cancer Center have resigned. So they're now looking for a new director. Yes. So we're basically spinning our wheels in terms of this. We don't really have a hospital in Cincinnati that is committed to the kind of cancer care that really makes a difference.
No, I'm very fond of it and plan to stay here for a long time. Thank you, though. No, will not. I will not move. No, I don't.
Somebody asking a question, or I think I'm just listening to somebody's phone. Yes, go ahead.
Outside the hospital, whether it's the city, the public clinic, or there are so many urgent care facilities now, as opposed to emergency rooms.
Right.
A little bit about that system and whether it's helped with access.
So the clinics do help with access, and they're all funded by Medicaid, and there are federally qualified health centers all over that, and the one not too far from here that comes to the church, I think once a month on Tuesday nights. They're going to have to shut down if Medicare does cut into their budgets in terms of what they're doing. I think urgent care is on the edge as well, but I don't know enough about them to speak with any degree of authority. We've not talked to anybody there who has indicated to us that they're really concerned about what's happening. But there's no question that as the clinics shut down, the emergency rooms will pack up even more. I mean, it's be more and more people, and people will be reluctant to go to the emergency room and wait for an entire day, unless they're really sick or their children are really sick. So the mortality rates will increase as a result of that. And the question is, will we have enough emergency room doctors to handle what's really going to be the increase? Again, not if Robert Kennedy has his way. He doesn't like medicine. He doesn't like science. He doesn't like emergency care. All those things are not in his report on making America healthy again. He very, very subtly attacks all science that has to do with journals. It has to do with clinical research, and it has to do with science. So it's scary. I mean, it's something like you'd say, I can't believe what I'm reading. I can't believe that there are people who say, let's shut the clinics. So 75% of the funding for the clinics comes from Medicaid. The other 25% comes largely from the city of Cincinnati. Whether they will have the money to supplement the cuts in Medicaid to keep the clinics open is a question that's wide open. We haven't even heard a discussion by the city council about that yet. So, but there will be discussions about it as the Senate passes this bill. The bill is right now in the Senate, and if it's not modified, then the cuts will come, and they will be dramatic, and they'll be legal, which is something unusual for the Trump administration to have a legal leg to stand on. So it's medicine as we don't know it. I mean, it's healthcare as we don't know it. And we have some med students in our organization, and they're just trembling. Well, what? And they're African-American med students, and they've been here at the church, and they've been wonderful, and they go to all of our programs with us. And the question is, will they have jobs? Will they have residencies? Will they be treated with fairness in the hospital systems as the systems? So we asked the acting head of the cancer center, what are you going to do about the cutting out of DEI in the cancer center? You can't hire Black doctors because you want to hire Black doctors. You can't hire women. You can't hire Puerto Ricans or Hispanic people. And he said, we'll just change the words. We'll just make believe. We're not going to give up our commitment to diversity and equity until they force us to. We asked the vice president of the school system, what are you going to do? They were forced 4 weeks ago to sign a statement saying we're going to get rid of all DEI programs, all programs that have to do with Black people, with Black history, with programs for the handicapped, for programs for people without English. You have to get rid of them, or we're not going to give you our federal money. We have $55 million in federal money going to the Cincinnati public schools. And the Cincinnati public schools and the Dayton public schools and the Columbus public schools said, no, we're not going to sign that. But right now, there's been no backlash by the government saying, we'll take the $55 million from Cincinnati yet. But the question that the vice president raised yesterday was, how do we make a budget? Do we make a budget including the $55 million, or do we make a budget without the $55 million? And whatever we do is going to affect children and families in the city. So again, the big question mark, we don't really know.
Steve, you have a online, can't see it. Understanding that this is from Rhonda Holyfield, Manager. Understanding that this is a moving target, do you have a summary of the potential implications of these cuts? This would be a good document to push out to others.
I have a document that's been prepared by, I forget the name of the organization, that details what this is. And if someone writes me at my email, steve.c.sunderland@icloud.com, I'll be happy to send that to people. It's very hard to read. It's a devastating series of cuts across the board. But yes, there are organizations that have done that homework. What will it mean if we have work requirements, and then we have bureaucratic paper requirements, what will those two things do to Medicare recipients? And they projected 7.5 million the first year will be cut from the program, and then multiples of millions in the next 10 years. So yes, I can send that to people. In the North Pole, it's steve.c.sunderland@icloud.com. c.sunderland@icloud.com.
One of the reports I've seen suggests that children will be the largest casualty of the Medicaid. I understand the impact of work requirements. And I imagine what the requirements, what administrative requirements might do, but where's the liability, I guess? Where's the vulnerability for the children?
The vulnerability for the children is that all children's medical services are paid for by Medicaid. So if that is cut, and if their parent or guardian cannot get a work requirement, cannot meet the exemptions, cannot fill out the paperwork, then those children will not get health care at all, except through the emergency room, where their government requires them to handle every patient that comes in. But that means hours of wait for those children. And it means the closing of the school-based clinics in the Cincinnati public schools, which will be dramatic in terms of children not getting dental work, not getting their vision, and not getting opportunities to meet with nurses or nurse practitioners. So it's the Kennedy report, Making America Healthy Again, is 99% focused on children. And on one hand, saying children are being very poorly treated, they have terrible chronic illnesses, and so, but our solution to that is no more vaccines for them, no more food for them, no more support for them. Right. It's a logic that is staggering. I mean, we are cutting out what we mean by humanity in a large way. That's why I think we need to talk to congregations about this. We need to have a dialogue with people about, is this America? Is this what we want to hear? Is this, do we want to vote for this? I mean, is this what we're, we may be upset about, and I am upset about the healthcare system in general. We may be upset about the politicians. We may be upset about the fact that Biden was older than God. But is this what we want for America? I'm not sure. I don't think it is. So I hope sometimes we can get to that point where we don't need a tragedy to get everybody's attention. But as this rabbi said to me this morning, not a ripple in Washington or in the country about the killing of these two young people who were diplomats.
It's brilliant, their response, because it's flooding the zone with so much information and so many changes. And things aren't, you can protest about something, but if you don't really know what they're gonna do, it's a moving target, and so you don't know how to protest it. And so when you think about it, when I think about it, it's actually a brilliant move on their part to flood the zone, make uncertainty what the currency, uncertainty, so you can't really protest something because you don't know exactly if it's gonna go through. And I think a lot of people such as myself and other people who just look at it and go, wow, I don't know where to begin.
Right.
No, I think effective protests are going in every state, every big city across the country. Seems like you had a really terrific meeting yesterday, joining forces with some of these other coalitions that are working on a variety of issues. Might be as well as getting congregations to do that. It seems to be appropriate because now it's becoming even people that are unaware of the medical aspects of it. They understand Medicaid, is pretty important to the country. So it seems like that's a fitting place. I mean, in their typical groups like the League of Women Voters and Common Cause, you're taking on some of the issues, threats to democracy and that kind of thing. So there's, as you're saying, there's a variety of things to choose from, sometimes very confusing. But it's obviously attracted a lot of people who are protesting every day. So that's what gives me some optimism that there are these, even in states like Utah and things like, there are protests going on. But
I agree. But it would be so wonderful if we had someone of the stature of Owen standing up in front of the city council or standing up in front of this congregation and saying, I would know exactly what Jesus would do in this situation. There's no ambiguity about that. This is not Christian. This is not humane. This is not something which we can just close our eyes to as a congregation or as a citizenry. But unless we get people standing up and doing that, and I'm a small fish in this big, ocean. I'm trying to work with my coalition, and we're trying to find our voices. We're trying to, how do we put our minds around just exactly what you're saying so well, and not just protest, but understand that the kind of city we want to live in is not going to happen if these cuts go through, and nobody's going to protest it except us. Then we're going to be in that minority for the next 2 years until we can get that vote out that we think is possible.
You're a medium-sized fish.
You're a very generous man.
Steve, thank you for all that you are doing.
Yeah.
You're welcome. It's my pleasure and my nightmare. I have so many other things I'd like to do in health. And we thought we thought we would begin to get the hospitals on board to navigation. We thought we would begin to see a downward trend in terms of deaths of poor people in the city. And we're in the reverse gear, we're going.
What if they became a comprehensive cancer center?
That's right.
So they just need a comprehensive cancer center designation.
They make moderate efforts towards it. They go out to the navigator name, they tags people with that title.
Thanks for coming.
To the extent that Steve's talking, there's advice.
Okay.
Well, thank you all for listening online and here, and I appreciate the opportunity to talk about this, and I'm more than willing. This is my favorite church, so I'm just really happy to be back here, and you are doing the work, and I'm just honored to be a part of it.
Well, thanks. Hello, Owen. So
Good.
you know how to talk to him.
Good.
You had 10 viewers. You had 9 or 10 viewers on now.
Thank you.
Thanks, Dave.
Hi, Steve. Okay.